longer because time is going to be of the essence because we do have health department and we have appropriations in here at 1:30. So the Department of Mental Health has agreed to come and speak with us about their request. So if you all are ready, we'd just invite you to come on and share with us what your needs are. Senator Hobson may come in, but we'll go ahead and get started. Hey, good afternoon. Carlos is coming to help you out.
Okay, it's green. Got it. Thank you very much. Thank you. Thank you for having us this afternoon to share our budget request. My name is Wendy Bailey, and I'm the recently appointed Executive Director of the Department of Mental Health. Having served at the agency for the last 6 years, I'm excited about this opportunity to continue as a public servant for the state of Mississippi and to work with you. As many of you know, Ms. Mikula announced her retirement in November, and we have been working on a transition plan, and her last day is January 31st, so she's here with us today. But myself and Mr. Breland is going to present our budget request. So first off, in your handout, I have just a brief overview of Mississippi's mental health system. The Department of Mental Health of course, has state-operated programs, which is number 1 on that list. There's also regional community mental health centers, which comprise the state's mental health system. And then there are also other nonprofit and for-profit service organizations and agencies in the state. Currently, we have 125 DMH-certified providers in the state of Mississippi. Your next slide is our FY22 budget request. We are requesting $6.5 million more than the Joint Legislative Budget Committee's recommendations in general funds. This request is for restoration of the $4.5 million general fund cut and a $2 million increase that will go towards community-based services. Of that increase, of that $2 million increase, $1 million is for adult mental health services that will be given in the form of grants to community providers. And then the other $1 million will be dedicated to the expansion of the IDDD home and community-based waiver. So half of the funding is for mental health and half of the funding is for IDD. While we have 2,759 people who are receiving services right now through the IDDD home and community-based waiver, we also have 2,527 that are on the planning list. So this funding, this $1 million for IDD will help enroll an additional approximately 83 people onto the waiver for services. Let's see, your next slide, this goes into a little bit more detail about the $2 million. Again, you can see the average cost per person for the IDDD home and community-based waiver is $50,729, and you have those numbers that I just gave you regarding the number receiving services and then also the number that are on the planning list. Also, for the expansion of adult community-based services, to give you a little bit more of a breakdown for what that $1 million will fund, we are looking at additional supported employment sites in the state following the IPS model, which is an evidence-based model that is monitored to fidelity, and that would be in the community. And then we also are looking at expanding certified peer support specialists to crisis stabilization units across the state as well. And then using a portion of that for a medication assistance fund for individuals who do not have the funding to pay for their medication after they have been discharged from a state hospital and are in the community receiving services. And then also for some technical assistance and data monitoring and outcome monitoring so that we can closely look at the outcomes of the funding for community expansion across the state. Your next slide gives a little bit more detail on the Medicaid impact for the IDDD home and community-based waiver. The Department of Mental Health is the operating agency for the waiver, which is often referred to as the IDDD waiver. This program provides individualized supports and services to assist people to live in the community who have intellectual and developmental disabilities, who may otherwise be in a more restrictive environment, such as one of the IDD regional programs. So the central office pays the state share, which is actually in the dark black portion on those charts, and that is billed to DMH by the Division of Medicaid. And then, so for example, you can see that in 2020, the total billed dollars for the waiver were about $137 million, and based on the state share at that time of those billings, the total bill to DMH was $27.7 million. And you can see that's the other portion of the chart on that slide. The top section of that slide shows you the total billed, and the bottom is the total bill divided by the average count of people with claims in the waiver, or the average dollars. So you can see that the increase in billed amounts over the last several years, you can see from $83.5 million to $137.6 million in 2020. That's a combination of rate increases for the services provided, also increases in the average level of care that individuals may need to stay in the community, and also an increase in the total number enrolled in the waiver. Your next slide gives you a breakdown of the institutional care spending versus the community services spending. Over the last several years, DMH has focused on expanding community-based services so that Mississippians have access to the least restrictive environment that can meet their needs and the appropriate level of services that they may need. So you can see from FY12 through FY20, the state has increased its spending for community services by more than $88 million, while decreasing the reliance on institutional care by $70 million. Some of this funding has gone to, which I'm sure you may know, your mobile crisis response teams that are in your catchment area, intensive community support services like PACT and ICORT, which are intensive community outreach and recovery teams, intensive case management or intensive community support services, those services that help keep an individual in the community and reduce that reliance on institutional care. Also, with that community spending is the increase in the IDD waiver spending as well. So we have had a 39% reduction in our census from the IDD regional programs of individuals moving from the IDD regional programs to the community since FY12. And we continue to see that as well. Your next slide is the FY22 budget request expenditures, which shows you a breakdown of the FY22 expenditures, what we are anticipating. And then the next slide actually shows you that budget to be funded. So you can see your first pie chart is the total, and then your second pie chart that pulls out is actually the general fund spending. The next slide just kind of shows you a decrease in the number of DMH employees. As you can see, if you go back to FY09, we had 8,972 employees at the Department of Mental Health. And you can see on your chart for FY20, which is a date of September 30th, 2020, we had 5,677. And as of last month, as of December, that's down to 5,608. COVID has had an impact on that. I mean, we have had a decrease. You can just look from even from FY19 to FY20 and see close to 600 decrease in number of employees at our programs. And then your final slide, I wanted to kind of give you an overview of the FY21 funding, the current fiscal year, so you could see some of the expansion of services and supports. As you may recall, in the Department of Mental Health's appropriation bill, we were to shift $4 million of funding from the institutional care to community-based services, and this is in addition to the previous funding shifts that we had from institutions to community. So with that $4 million, there's been 9 additional intensive community outreach and recovery teams that are being, if they have not already, most of them have, been added to the community, and those are operated by your community mental health centers. Also, we've added 12 additional intensive community support specialists, and we have additional funding that's going to be provided for mobile crisis response teams. And then peer bridger programs, this is something, all of these activities are actually partnered with the community mental health centers, of course, who provide that direct service. But peer bridgers are certified peer support specialists, and our goal is to have those at all of the state hospitals and at the community mental health centers for a warm handoff and that connection as somebody transitions from the state hospital back to their community. So that's part of this funding. And then housing assessments for the Choice Housing Program. Also intakes at state hospitals. That is one thing that we use this funding for in the current fiscal year. And that allows a community mental health center to actually come to the state hospital or do it via telehealth to go ahead and do the intake while the person is still at the state hospital, to where that can be done before their first appointment at the community mental health center. So we've used part of that $4 million to cover that cost as well. And then also to look at a data tracking model for crisis services, particularly mobile crisis response teams, and that's going to be coming up as well. And then additional people enrolled on the IDDD home and community-based waiver. So that concludes my presentation. If there are any questions.
So basically, you're saying you need a little over $6 million above LBR?
Yes, ma'am.
request.
It's a little over $6 million.
Do
It's,
those things that you just, that you went over earlier?
yes.
And then you showed us where the extra funding has gone to, from this past year's budget.
Correct.
So, Senator Hobson, y'all have any questions? Senator Michelle?
This is a question for Chairman Hobson over you.
Mhm.
The PERS board's recommended increase where?
Touch the thing. We can't hear you.
The PERS board's recommended increase in withholding, matching, has that been taken into consideration in the budget request? Your budget request? I know it's just happened maybe recently before you did this.
Right. Let me, Mr. Breland.
Is that 2%?
Yes, sir. I'm not aware that the PERS board is taking any action regarding the increase. You're referring to the employer share.
Employer share, yes.
Or ask?
I'm aware of any actual increase that they've taken regarding that.
Okay. Mr. Chairman, will it be, will all budgets that we look at not have that in it, and we'll be dealing with that at a later time if it occurs? Or have any of them been told to plan for that?
Well, I'm not aware that PERS has actually made a decision on that, but I think I know the gist of your question. And obviously, every agency needs to understand that that a portion of the retirement will come out of their own budget. And so even if we funded agencies at level, if PERS increases the employer contribution, that's going to effectively result in a shortage of what they need to do to operate their agency.
Well, this time last year, it seemed like we had a directive from the PERS board, and that you don't think we'll get that prior to our budgeting process?
I don't want to speak for what the PERS board is going to do. Kelly, are you on the PERS board?
Yes, sir.
Okay. But maybe Kelly's the one that could answer some of those questions. You want to get to the microphone, Kelly, so that because we're on a live stream right now.
Good afternoon. Kelly Breland, and I am on the PERS board, and there's been no action that I'm aware of, at least, that where the rate has been increased. Now, there was a rate increase to 17.4 from 15.75, and that was a couple of years ago. This may be the full second year, possibly the third, since that's been put in place. And there has been some discussion about the rate, but I think if there's a rate implemented and approved by the board, if there's one, it would happen at the beginning of fiscal year 2023. I believe that's the earliest it would happen. If the board took action now, it would not occur this coming July. It would be the following July.
And also, Kelly, we have to have a statutory change, don't we, for that? Seems like?
No, ma'am, not.
One before? Not. Just for the employee, okay.
That's right. For the
Okay.
employer and employee rates, the board has the purview to change those, I believe. The problem with the employee rate is
That is
you're into a
statutory.
contract situation
Yeah.
where you've got to give up something of consideration on both sides, and the PERS board has no authority to give up anything of consideration or value from the state's end. So normally when you've seen an employee increase, there's been some consideration from the state, and usually that comes from the legislature to do that.
I
So-
think we're just looking at those published reports that indicate that, you know, the time's coming nigh to where the board's gonna be asking for more. So I think that's where Senator Michelle's question's coming from, because we've all seen those reports.
Yes, and the PERS board is in the motions to look at the rate, because the actuarial report that comes out highlighting those and their recommendations was received in December.
Yeah.
So we are currently looking at those to see whether action is needed by the board.
Anybody else have any further questions? Thank y'all. We appreciate you coming and sharing with us, and stay in touch with us. Don't think that it has to be a formal budget hearing for, you know, because the sooner we know things, the better. So, you know, our door is open. You can always call us, Senator Hobson, and I, and all these members. So thank y'all.
Absolutely, and same here. You can always reach out to me. Thank you.
Dobbs. Okay, I think we see Dr. Dobbs coming in the door. Department of Mental Health has just finished, so y'all are welcome to come on in and give your presentation if you're ready.
Are y'all trying to scare me?
Oh, he's
Or medical issues. If you have medical issues, you're welcome to go ahead and get it. And this is going to be pretty quick, but I did want to just make a couple of points. If y'all could hear me out and then answer a bunch of questions, and then Sharon, who's our CFO and Chief Administrative Officer, can answer detailed questions for you guys. As far as our budget request goes, it's pretty simple. We would like for you guys to consider getting us backed up to where we were last year in our general, in our state general fund budget. And the reason for that is that we depend on that state general fund money to run our county health operations. So the nurses that we pay to do reproductive health or to treat syphilis or treat TB, that's really where that money comes from. We do have a lot of federal money for like certain things like coronavirus or HIV, but the stuff that happens at home is going to be a lot of the stuff that you guys help us with. We actually did have to shut down some family planning clinics and move some nurses out of county health departments. We didn't have to close any health departments last year, but if we want to do more in the locations where we can help folks most, that little bit of help will help us put more nurses on the ground, and that would be fantastic. The only thing that we'd like you to consider, we are expanding our health equity footprint for preventive health and also too for disparities. Dr. Victor Sutton, who's been a fantastic asset through the coronavirus, I don't know if y'all have met him. We have folks doing blood pressure checks in barber shops, working with faith, community faith nurses in churches to do blood pressure checks and counseling and diet. It's a small investment. It's only a small piece of the budget that we do for preventive health and health equity, but it gives us flexibility to do stuff. Otherwise, it's not grant specific. And that's one of our big challenges, like a lot of agencies, is we're so siloed by our funding. Having just a little bit of state money to kind of balance it helps us basically leverage and catalyze a different action. So if that's something that you'd be willing to consider, we'd like to advance some of these preventive efforts, especially within the Black community. And then as far as special fund authority goes, you know, most of our money does not come from the state legislature. We just need permission to spend money. And so we do want to keep it at level spending authority at around $470 million. And that sounds like a lot of money, but the reason why it's a lot of money is like a lot of it's like WIC commodities, things that are just things we do for the community. About 50% of the stuff that we spend is direct grants or direct commodities to your communities. And this just gives us permission to spend it. It's not real money. I mean, it's real money somewhere, but it's not money that comes out of your pocket. So just obviously just permission to spend federal money to do good things in the state. And the same thing with trauma is to keep the trauma fund at the spending authority of $28 million. Now, the trauma fund doesn't get that much money every year, but we might. It's dependent upon, like, you know, court fees and things like that. So we just want to have permission to spend as much money as comes in. And the trauma system, you know, what it does is it reimburses hospitals and ambulances and stuff to make sure that if someone has a car wreck in your town, that we have a system in place that can get them to where they can get the best care possible. So again, that's just spending authority. And then for our bond request, we do definitely want to get the full amount for our rural water loans. Rural water, this is a fantastic thing. It's a 5-to-1 match for federal money. And if you actually give us the maximum, we will get more than this amount of money in loan forgiveness for the local water systems. So basically, if we get the full match, not only do we get like $15 million to loan to rural communities at like a 1% interest rate, right? And it's got kind of like vanishingly low. But we also will get enough money back in loan forgiveness that more than surpasses the amount of commitment from the state. So it's really just it's just slam dunk win. That money doesn't really come to us. It all goes to local communities. So that's super easy. And then we do have the an Underwood building renovation. We do have an old building that was built in the 50s that really hasn't been renovated. Half of it is actually closed because it's not safe to occupy. And if you guys would consider helping us get it renovated through a bond process, that would be fantastic, and we can move folks there. It's not that we'd save some state money because we could move some state folks here that are using property, but it wouldn't save that much, honestly. So, because a lot of them are federal folks, and we can't use federal money to pay for this piece, but it would help our operations. And I think that's what I have. Sharon, did you have anything you wanted to add before we take questions?
So it's a two-phase process. We met with DFA. Phase 1 would be to renovate our old lab, which right now is currently just used for storage because it's not inhabitable. It's just horrible conditions. And once that space was renovated, we would then have phase 2, which is to actually renovate the current space that we are occupying in the Underwood building. And we are going to try to bring some offices back on campus, but like Dr. Dobbs said, they're not really funded with state general funds. They're funded with fees or federal funds. But just try to get everybody more centralized would be just better for everyone to be together. And like with the spending fund authority, again, like I said, it's not real cash from the state, but the ability to be able to spend our federal funds and our actual cash. You know, we have probably over 100 federal grants every year, so this would be a great opportunity. Do you have any specific questions for me or Dr. Dobbs?
Go ahead. Senator Hobson, I believe, has a question.
Thank you, Madam Chair, and thank you both. And Dr. Dobbs, first of all, thank you for your work during this past year with the pandemic and everything. I know you've had your hands full, and I appreciate it. And also, even as busy as you are, you've been very responsive to individual districts' needs, and I'm grateful for that. And I think I would speak for most of the members of the legislature about the hard work that you and your team have done to deal with a tough situation. And a couple of questions about. Let me start with the last thing. Obviously, the budget. I mean, the bond issue is going to be a finance side of the chamber. Not a lot we can do with that level of funding for you. It's not operations. But did we put money in the Underwood building a few years back? I thought we had allocated some funds, and we did. Maybe we did it in the Senate, and it didn't clear the hurdles of both chambers. But I do recall that
The lab, though, we probably put some money in the state lab.
Okay, so is the 18.5 billion, is that the building and the lab?
It's our old lab building and the Underwood, so they're sort of joined hallway. So the public health lab, built a new building, so they vacated the old lab. So we're trying to renovate the old lab to make it office space.
Okay.
So that's just part of that. I don't believe we received any money after 16 years. I don't believe we received any bond money for this particular project.
Yeah, I'm almost positive we had it in one of our Senate
Like we did.
bills the last couple of years. But anyway, it didn't clear all the hurdles, so I understand. Can you go back to the trauma fund? How does it stand right now?
You know, it's pulling down around 21, 22 million a year. Isn't that right, Sharon? And so every bit of that goes out. And I don't know if you're aware, but we also did enter into an agreement with Medicaid this year for the 15% portion that covers ambulances, and we're going to use that to draw down more money as federal match through Medicaid. So
Okay.
that's an innovative thing happening this year. So it's really a great service because a lot of the trauma stuff is unreimbursed. There's a high number of folks that are uninsured,
Right.
and it helps keep those services around. Yes, sir.
No, it's a great program, and I just curious as to how it's doing. I realize it's kind of self-funded, but is it square? Is it good right now? Is your level of funding, the money that's coming in for, is good enough to keep things? I'm not saying it's got to be a Cadillac program, but it's operable and working well.
Yeah, I think it's meeting the basic needs. I mean, the hospitals will tell you they need more money.
Yeah.
But
We have the level, for the funds we're actually receiving, we have the current level of authority we need to spend what we currently are receiving. But could that go up because we'll have more recs and all that, more revenue come in, then we need to increase our authority. Because out of this 28 million authority, about 7 point something, I forget, million is actually from the general funds, and then the balance comes out of actually the fees.
Yeah. Okay. Well, just keep us posted. Keep Senator Hill, she's the chairman of the committee, and keep us posted on if there are any issues that are occurring. Because I've been around it long enough to know it's kind of gone up and down at times. You know, you don't hear anything. No news is good news. And then I think one year we had to make some adjustments to it, and that was many years ago. But I just want to keep an eye on that. And then the final question I had was the rural water program. Is that are those the funds, I can't recall, that are used to also do the inspections of septic systems and those things, or is that something entirely different?
that's different, yeah.
Okay.
Yes, sir. Yes, sir. This is strictly bond funds, low interest loans for community water systems. This is, you know, we kind of split some of the stuff with DEQ. We do the on-site wastewater, and then we have, you know, a water program that makes fresh water, right? There's a front side and a back side, right? And we're really, for the front, this is really the water provision situation.
Okay, so this is the rural water associations connected with the funds that rural water associations use.
Yes, sir. Yes, sir.
At some point, maybe after this meeting, or if we have time, if not, I want to visit with you about that just briefly.
Okay.
Okay, thank you all very much. Thank you, Madam Chair.
Does anybody else have any questions or comments? I also wanted to reiterate what Senator Hobson said. We appreciate you answering your phone and getting back with us, because many times, you know, these things, timing is of the essence on some of these things that we're asking about, and we do appreciate that, because, you know, we don't know the answer, so we're coming to you for the answers, and just want to reiterate that we appreciate it.
Madam Chair.
Yes. Senator Moore?
Quick question. You know, for folks in the state and us here at the Capitol, for those of us that are not 65, do you anticipate that number beginning to drop in the future weeks that we could get vaccination?
It may be a little while until we sort of kind of drop down. We had a plan that was kind of really aligned with the CDC tiers, more or less, and it was going to be 75, and it was like healthcare, nursing homes, then 75 older, and then essential workers, which I think that you guys certainly qualify, and then over 65 and that sort of thing. So we had a sort of like a tectonic shift. Federal guidance basically said throw away the old thing. We're going to go to 65 and older medical conditions, and so it kind of really shifted us off. So in Mississippi, we have 1.2 million people who qualify as being 65 and older or medical conditions. We get about 37 to 40,000 doses of vaccine a week. So there's a pretty severe imbalance in that. But that being said, I do think it'll be probably in some weeks we could look at as essentials are added, and I think the governor is interested in that. I think that you guys are very essential.
We've had 2 that had to leave this week, just from this end. So, and when you start getting some key chairmen that have to leave and go, and the third one that was sick, you know, it could throw a real quagmire into things if that's possible.
Now, I will say that, you know, we have, because of critical operations like with MEMA or the health department staff and stuff, who are on orders, we have done vaccinations because we have to run, and I think there's probably some real strong logic in that. I mean, our federal legislators have all been immunized, right? And so that's certainly a conversation that I'm very willing to entertain if you want to, about doing that sooner.
So
Just to
please think about that.
Yes, sir, yes, sir.
To follow up on Senator Moran, we're hearing from various sources that, you know, hospitals and nursing homes have been allocated X number of vaccines and that they've not given very many of these vaccines out in proportionality to what their allocation was. Is there anything you can report to that? Because, you know, people are hearing that there's, you know, vaccines sitting in storage that aren't being used, that you know, that they've not deployed. And I know from my own nursing home what I'm hearing. So can you just give us any kind of update on how we can get that ball rolling to get those vaccines out there faster, especially in the nursing homes?
Yes, ma'am. And there are two separate issues, and I'll tell you about them. So the nursing home one was a federal program, and all the nursing homes signed up with the CVS or Walgreens to get the vaccinations. And so this is one of the reasons why we've been so delayed, unfortunately, is we allocated 47 and then like 90,000 of our doses to the long-term care plan. And it took them a while to get rolling. And even in Mississippi, they were rolling more slowly. We have been working closely with them. Some hospitals actually have gone ahead and vaccinated their nursing home folks, and that's great. The CVS and Walgreens have increased capacity, and we've been working with them, so I think that is going better. Certainly, we'd like to go even faster, but it's still, but we are pulling some of that vaccine back. So it's all Pfizer vaccine, and we're going to pull back about 5,800 doses from that program this week to give to other folks so that we can do it. And as much as we can, we'll try to pull back more because they haven't been able to use it yet. We are sort of at the mercy of the feds on this one because they control that inventory, and so it takes a little bit of while. Actually, the 5,800 that we're going to get this week, we requested from them 2 weeks ago.
And you have to be so careful because that's the vaccine that has to be at such a low temperature.
Right.
Correct?
Yeah, and so we have to be careful about where it goes.
Typically, that's a nightmare to keep moving those. I mean, if you're actually physically moving them from one location to another, I don't know the logistics, but I'm sure that's quite a challenge.
It is a challenge, it really is. And so they're catching up, but they're still pretty slow. On the hospital and private side, you know, it made a lot of sense for us to give the hospitals and clinics vaccine on the first go because that's where the healthcare workers are when that was our focus. And what we've seen is probably about, of the first doses that we've given out, probably about 65% of doses are in people now. So it's a majority, but it's not a totality. And what we see is we have some places that are really good at getting it out and are still getting it out. And then we have others that are not as good. And so we're going to look at maybe pulling vaccine back from those who are not performing. We're going to look at not giving them to those who are not performing, or see what we can do to accelerate that. So that's a different problem. I think that we will see a good bit of headway going forward. The places that are doing mass clinics, like setting up and having 500 people. I know South Central, where I live in Laurel, in the weekends, they did 500 in a day. Some places have 500 doses and they're sitting on them just waiting for the people to come for their regular follow-up appointment and get a shot, and that's just not going to work. So that's kind of where we are in our challenge, but a lot of hospitals have done great and some are not doing as well.
I think Senator Hobson has another follow-up question.
Yes.
Thank you, Madam Chair. And Dr. Dobbs, you're jumping all around this point right now, talking about getting the vaccines out, but and we do have a media source here, I realize. Let me be clear. We in Mississippi need to get the vaccines distributed and in people's arms in order to draw down federal requests for vaccines. Is that correct?
They have indicated that that's going to be a future metric to determine future allocations. They haven't changed that rule yet, but they've said, hey, if you don't get it in people's arms now, it's going to lower the amount you get in the future. Yes, sir.
So just to be clear for people that may be listening, we need to do everything we can to get vaccines in our citizens' arms as soon as possible.
As soon as possible. And put it in the system. That's the other thing, is we've seen people who've given shots and like, oh, that bureaucratic red tape. I'm like, listen, if it doesn't get in here, CDC doesn't see it, and the feds don't see it.
And again,
we don't get any credit for it.
So we're clear, for those providers, they need to enter the data so it gets back to you so that we know that we're getting shots in our citizens' arms.
Right, and I did talk to a clinic over the weekend, and I said, hey, and it's a small clinic, you know, we try to keep close to them, and I said, hey, it shows that you've given we gave you 100 doses and you've only given 20, what's up? And he said, no, we gave them all. We're just waiting to put them in the system. And I'm like, no. They actually sign an agreement that says they'll put them in the system within 24 hours. And so we're going to have to hold them accountable to that. Because I do think there are actually some proportion of that vaccine unused is actually used. They just haven't put it in the reporting system yet.
Okay, thank you, Dr. Dobbs. Thank you, Madam Chair.
Thank you.
Thank you so much. Do I have a motion? All in favor?